And welcome to today's session on building clinical skills and improving outcome through standardized evidence-based approach method. I'm Jade, the marketing manager for Southeast Asia, and I'll be your moderator for today. So in the aftermath of COVID-19, hospitals and medical education institutions continue to explore and innovate teaching, learning, and professional development as they settle into the new norm. Skill development and training during this period could be challenging for both medical schools and hospitals. So in order to support continuity in skills development, our previous webinar today aims to introduce you to clinical skills, a comprehensive online solution accessible on any mobile device that enables organizations to standardize education and manage competency amongst the nurses, therapists, and other health professionals. I'm delighted to introduce our Elsevier speaker for today, Ms. Natasha Gulati, the Clinical Solutions Manager for Southeast Asia, handling health sciences portfolio. She has over 10 years of management consulting experience across various healthcare sectors, including pharmaceuticals, hospital infrastructure, and health technology. At present, Natasha works with healthcare providers, medical associations, and universities to help them adopt technology and analytics platforms to improve care delivery and medical education. So before handing over to Natasha, I would like to share a little bit on the housekeeping rules. So just to quick share that this webinar is being recorded, and I'll be sending out the recorded version 1 to 2 days after the event. And this session is being conducted in Zoom webinar format. So looking at the bottom of the screen, you will see a Q&A box. So if you have any questions along the way, kindly use the Q&A box. There will be poll questions during this session as well. So the poll will be popping up on the screen later on when the speaker opens it. So we encourage you to share your opinion, and the results will be displayed when the poll is closed. Last but not least, we appreciate your feedback. So at the end of this Zoom meeting, there will be auto-routed to a survey form. So kindly leave behind your comments and feedback and for our reference, and we'll get in touch with you shortly. And with that, I will hand over the floor to Natasha. Natasha, please.
Thank you so much, Jade. And I must thank for all the people who've joined our session today. It is my pleasure to be speaking to you all, and thank you for the opportunity. So some of you have also joined us for the previous webinars that Jade has kindly helped us organize. Elsevier Health Live is a monthly channel where we are putting out thought leadership webinars every month. In our previous webinars, some of you may remember those who attended, we talked about the various challenges that medical education and nursing education has been trying to overcome during this COVID-19 pandemic. Through all our webinars, the one big question that emerged was that how do we improve on clinical skills? In our previous webinar, we touched upon this topic from a theoretical standpoint. And in today's webinar, we're going to go into more detail and more practical solutions that can help you in conducting skills development for your students. Before we go into the details, I just want to share for our agenda today. We'll talk a little bit about why it's important to focus on skills development for nurses. We'll talk about what are the challenges posed by COVID-19 in skills development. We'll then talk about how Elsevier can help. And then we will have a short round of Q&A. We'll also share some additional resources that can help with nursing skill development. Just to reiterate what Jade mentioned earlier, we want this webinar to be very interactive. So our presentation time will not be more than 40 to 45 minutes. We leave enough time for Q&A towards the end. I would be very grateful if all our attendees could post as many questions as you like in the Q&A box, or you can even post your questions in the chat. Jade will help me monitor the questions and the chat, and we will respond accordingly. Throughout this webinar, we will be asking you questions. We will be asking you for your feedback. So please do share your comments and feedback via the chat or the poll. And we will also ask you to click on links and support us in other ways as we go along in this presentation. So I hope you find our session today engaging and interesting, as well as useful for your students. First of all, let's talk about why is nursing skills development really important. If you think about it, traditionally nursing curriculum, whether it's in the school or whether it's long-term development of nurses in a professional setting, has been a little bit theoretical. One of the challenges that we face is the fact that nursing education and skills development, they are siloed. One of the challenges is that there is a high dependency on textual learning, whereas skills development is kept as a separate problem. So nowadays, what we need to do is kind of try to merge the lines, blur the lines between skills development, problem solving, critical thinking, decision making, and textual learning. We need to put all of them together and have a more holistic view of the skills development curriculum. We need to have a broader view of curriculum so that you can reduce the gap between theory and practice and help to prepare nurses for practice and long-term leadership. We don't want to prepare them only for clinical setting, but we want to really prepare our students for practice. And that's why a lot of universities have actually identified a number of training domains. You'll see that all of these domains go much far beyond textual learning. They're actually very hands-on kind of domains that need experience, that need exposure to really be able to master. The COVID-19 pandemic has really been a testament to every single health system. Healthcare workers have tirelessly worked in protecting our communities. A lot of healthcare workers actually still kept coming to work, despite the fact that it posed great challenges to their own safety and to the safety of their loved ones. And in this entire gamut, the one group of professionals who was literally at the forefront were the nurses. The nurses were working in extremely challenging times. They had to be agile. They had to have very good critical thinking and problem solving skills in their, on their toes. And at the same time, they had to really overcome an environment where clinical guidelines were changing every day. The work environment was changing every day. So they needed to be really agile in their practice. And that was a huge challenge, a huge workplace change for the nurses. Similarly, if you think about the students have also been quite affected by COVID. We already know that a lot of universities have moved towards online learning, but that's just one part of the story. Online learning comes with its own challenges. There are challenges in being able to access material. There are challenges in being able to, even simple things like internet bandwidth or the quality of images that you get or the quality of videos that you get over images, over internet have impacted the quality of learning for students. So Elsevier has conducted surveys all over the world where we've tried to collect feedback from various healthcare professionals on how COVID-19 has impacted them. One of the group of people that we spoke to was students, and this is feedback coming directly from students. Majority of the student respondents agreed that online learning is possible, it is viable, it is doable, but it cannot substitute for skills development. All students agreed that practical learning and skills development was definitely suffering during COVID-19. And that's where a lot of universities started showing innovation as well. In our previous webinar sessions also, we saw many new examples of how universities have quickly moved towards online learning. And then here also you see that a lot of nurses, a lot of nursing educations, institutes and nursing professionals quickly pivoted towards online learning. They didn't only change their practice, but they were kind enough to also start sharing best practices. They started creating new strategies for education, new strategies for disseminating content, and they started sharing all of that through open forums as well as through published paper. So for example, on this screen right now, you see that for nursing education, there are a number of tools available, such as virtual learning, video, telemedicine, online gaming platforms, online quizzing platforms. All of these are available. And there is past literature to show that some of these platforms like video telemedicine and video streaming are actually effective in improving learning outcomes for nurses. So I would like to hear from you on whether you have used any of these platforms to date or not. We're starting a poll. You should be able to see a poll question on your screen. The question is very simple. I want to hear from the audience. Have you tested or implemented any of the following teaching approaches for skills development at your hospital or university? And you can choose from virtual lectures to telemedicine, online discussion boards, videos, simulations, or online quizzes. I'm just going to give it 30 seconds for everyone to respond. I'm seeing the votes come in, so I'm just going to wait for the votes. I'd like you to select as many options that you have used. So if you've used more than one of the options on the screen, please do click multiple options, because we really want to understand what universities are in the region are doing right now to support skills development. I see there are still some votes coming in, so I'm just going to give it a few more seconds. Okay, so we're going to end the poll and I'm going to share these results so that you can also see. You'll see that most faculty, most of the attendees in the webinar today are already using virtual lectures. A number of them are also using videos. And as I showed on the earlier screen, there is past literature to show that videos can actually be an effective way of demonstrating skills for education. We also see some people using telemedicine. And if you remember in the previous webinar that we did with a Singaporean lecturer, they mentioned the use of telemedicine for skills development amongst medicine students. That's great. So it's good to see that telemedicine is also being used. And of course, a number of you are using online discussion boards, quizzes, and even simulations. That's quite advanced, the fact that you're using simulations. That's great. So let me ask you another question. Since you've been using all of these technologies, especially during COVID-19, what has been the impact of these technologies on the nursing skills learning? I'm launching another poll and I'd like to hear from you. While there is some research that I flashed earlier that says that these tools are effective, I'd like to hear from the audience on whether you really think the tools are effective, not the same, or really not effective in helping nursing skills development. Again, I'm just going to give it 10 seconds for everyone to answer. Okay, so I'm going to stop the poll and let me share the results with you. Interestingly, and at the same time, a little bit curiously, majority of the users have said not so effective, but then again, by majority, I mean only 36% have said that it's not so effective. 19% have said quite effective, 24% have said that it is effective. So there are clearly, it's a mixed crowd. There are some who find these tools effective and there are some who don't. And there can be so many reasons for that. I do understand that nursing skill development is extreme. It's a very, very hands-on kind of an experience. It's a very, very experiential learning. And I see that there is a question on the group that says that in their country, most of the classes are limited to online. So how will we teach laboratory courses in a skills-based technique? And that's a very, very fair question. because a lot of us, not just all of you, but me myself, we all come from this background where we believe that skills learning has to be hands-on. We believe that it needs to be experiential. But now, because of COVID-19, we need to be a little bit more flexible. We need to be innovative. How do we replace the idea of getting an experience with something else that can be taught online, right? So let's think about what is experience really. What is experience really? Experience means that a student is able to pick up cues which are not written or stated anywhere. That means that the student is able to observe things which have not been explicitly stated. So therefore, to allow students to pick up factors that they would generally do by observing, you need to now explicitly start stating these things. So if you're in an online setting, if you're in an online mode and you need to demonstrate a skill, you need to be able to demonstrate it, not just the skill itself, but also put in enough text, enough images, enough videos to show all the peripheral things that in a laboratory class, the student would have observed. But now you need to explicitly state them because the whole class has moved online. The student is not physically present to observe, and therefore you have to state these factors. So our first step towards supporting nursing skills education and development was to put together a comprehensive platform that makes everything in skills development explicit. Let me share with you why this is important for us as Elsevier. At Elsevier, we truly believe our goal, our mission is to improve healthcare delivery by empowering all types of healthcare professionals. We want to improve every single patient outcome by empowering physicians, nurses, allied health professionals, as well as students. We support students from day one. We support students from day one of their career, which is their first day in university. And because of that, we provide a number of solutions that can be used by professionals in the clinical setting, as well as in the university setting, to make sure that they have absorbed all the information and are ready to apply that information in a practical manner. So from that perspective, we are now introducing a platform called Clinical Skills. This is a comprehensive skills development platform that focuses on nursing skills. As mentioned in the webinar invite, this is a new platform which we're launching in Asia, in Southeast Asia. For all of those attendees today who would like to organize a complimentary access to the platform for your institution, please click on the link that is now being shared in the chat. So in the chat, my colleague Jade has shared a link. In that link, you just need to provide your feedback and leave your name and institution name, and we will reach out to you to set up complimentary access for your institution for this platform. So what is really clinical skills? Clinical skills gives you access to over 1900 evidence-based skills and procedures that will help you ensure that knowledge and skills are current, reflective of best practices, and follow the latest clinical guidelines. Just to break it down, through the platform, we are trying to make available more than 1900 evidence-based nursing skills. So these are skills based on published, reviewed clinical guidelines. We are not only sharing how the skill or procedure needs to be performed, we are also sharing ancillary material, which will allow the student to be prepared when they are in the clinical environment. And I will show you what this really means. And all the content that is available here is actually based on global clinical guidelines and best practices. The skills are actually divided into many collections. So there is a core collection, which is like the most basic collection for any nursing graduate. And then we also have specialty collections for pediatrics, emergency nursing, oncology, etc. So if you're interested in reading up what those skills really are, you can always click on the link at the bottom of the screen. So to give you an example of what it really means to have not just the procedure or skill, but the ancillary content also. You will notice that every single skill or procedure contains not only a video, but a number of other text and multimedia options. So in the text, you have quick sheets, you have extended text, you have a list of supplies, you have a list of emergency pointers to look out for, and you also have a number of images and a checklist, which are very useful for students when they are actually applying the skill in a clinical environment. For more advanced institutions who are already using the platform, they also have the ability to create customized learning content. So you are not limited to only using the skills which are available in the platform. You can actually create customized lectures, and these lectures are very useful for you to be able to share in your online classroom. You can even share the lectures offline and the students can review them in their free time. So let me show you now how the platform really works. So this is what the platform looks like. As I said, it's a skills platform, but it also has access to patient education. I'll show you why. It's a very, very simple interface. You see, you can simply search for a skill.
Natasha is not showing.
Oh, really?
On screen, yeah.
Let me stop share and share again. Let me know when you can see it.
Yeah, it's up.
Sorry about that. Sorry, everyone. I hope you can all see my screen now. So as I was saying, it's a very, very simple platform. You can actually search for skills or for patient education, but let's start with skills. So you can search for a skill on the search bar. You can browse for a particular skill that you're looking for, or you can even browse by specialty. So as you can see, we already have the latest COVID-19 skills, more than 168 skills related to COVID-19. We have a number of other skills. We also have skills by category that you can search for, or you can see what is the latest updates. So for example, in the latest changes section, you can see that the oxytocin skills graph was updated in June. Skin traction skills graph was updated in June. So you can see over here what are the changes that have been made to the recent skills. To start with, I'm just going to search for a particular skill. Let's say I start with so when I type a search term, you can see already that it's giving me some options. Maybe these are options that people around the world have been searching for very frequently. I can either go into one of these options, or I can just stick with my search term and I hit search. The little magnifying glass, that's your search button. So as you can see, in relation to intramuscular injection, we have more than 51 results. The results are actually 51 skills. You also have education, medication, patient education, medication. So that means what does your patient need to know related to certain medications? And you have patient education related to conditions and treatment. So one of the most important things that nurses need to develop are communication skills. You need to be able to speak to your customer. You need to be able to speak to your patient in a manner that he can understand, she can understand, and yet it is compassionate, it's holistic, and it's complete information. So you don't need to now look for the information. You can actually download these patient education documents. Let me show you one. So you can actually download this document. You will realize that this document has all the clinical information that you need to share with your patient in a simple language that they can understand. So you can share this document, print it out and share it as is with your patient. There's a print icon over here. or you can read the bullet points from here and share it via communication. So you can speak out the bullet points to your patient. There are absolutely no copyright issues. If you want to print it and share it with your patients, or if you want to print it and paste it outside a hospital ward, that's fine too. So that's how the education content is useful for nurses. It really helps to develop the skills, the communication skills, the language to be used. Coming back to the actual clinical skills, as I mentioned, for intramuscular injection, there are about 51 results. And you can see a lot of the results are divided into segments. So you could be looking at intramuscular injection in home healthcare, or intramuscular injection in ambulatory settings, intramuscular injection for pediatrics. There are also results for certain specialties, like for oncology, or for certain kinds of medicines. You'll have separate skills on that. You can actually go through this, or you can actually filter the skills. So if you're looking for a specific age, for example, pediatric, you can choose pediatric skills over here. If you're looking for a particular specialty, you can actually choose from here. Or you could also look for a particular category and choose a category from here. So at the moment, maybe I'm not going to choose any filter. I'm just going to show you what a skill looks like. I'm clicking on the ambulatory option for intramuscular injection. So you see every single skills document starts with the quick sheet. The quick sheet always starts with the urgent action. So the text in red is the most important and urgent information that a practitioner needs to keep in mind all the time when they are performing this skill. So the red text is of critical importance to learn. And then everything else, all the other steps and key points are provided in a bulleted format. The bulleted format is supported with images, tables, and instructions on the right, so that the students can visualize as well. There is also extended text. So let's say if you don't want the student to just read the bulleted points, you want a more theoretical, in-depth knowledge, you could also read at the theoretical knowledge. There is a very interesting supplies list. So this is very handy. One of the things that we observe when we're performing skills in a laboratory is, what all did my coach put in front of him? I know I used to always try to observe what were the beakers and the gauzes that they kept. I used to always try to subconsciously observe what they kept ready before trying to perform a skill. Now you don't need to subconsciously observe. You can actually refer to this supplies list and make sure that your students develop a habit of keeping the supplies list ready before they perform a skill. And then, of course, there are plenty of videos to demonstrate the skill. The videos can be of different types of information. So let me show you one.
Check accuracy and completeness of the practitioner's original order. Obtain the medication and verify the expiration date. Inspect the medication for particulates, discoloration, or other loss of integrity. Ensure the 6 rights of medication safety: right medication, right dose, right time, right route, right patient, and right documentation. Label all medications, medication containers, and other solutions that are both on.
So for all the skills, you have a number of these kind of videos available, which you can share with your nursing staff or with your nursing students in an online environment. Just like how I'm sharing this with you on Zoom, you can share this with your learning and your staff and your students. Moving forward, along with the videos, there are also some brief tests which you could refer to very briefly. And there is also a checklist. So again, as an observer or as a faculty who's trying to observe the students, whether they're performing the skills correctly or not, you could use this checklist and even in the clinical environment, if you're trying to observe your nurses, you could use this checklist and really try to understand whether your student or your staff are following all the evidence-based practice guidelines or not. So to start with, are they performing hand hygiene? Are they determining the patient's current symptoms? So every single line item over here is based on evidence-based best practices. If you follow these checklists and if you encourage your staff and students to follow these checklists, you are basically helping your organization to ensure that you're following evidence-based practices. So these checklists are very helpful in developing that evidence-based culture and habit in your organization. So that's mostly everything about the platform. As I said, it's very, very simple. It is a very simple yet comprehensive compendium of the best, highest quality evidence-based nursing skills that you would need for your institution. As I mentioned earlier, you also have the option, so very advanced organizations have the option of creating their own educational content using this platform. So for that, I will just need to log in. Give me a minute while the system logs in. So when the users log in as an administrator or a faculty, you see that there are so many more options available to you as a faculty or as an administrator. You can actually create e-learning modules. So you see there is an option to create an assignable module. There is options to edit existing modules. You can create trainings. You can publish the modules globally across your organization. So there's a lot more that you can do in terms of creating good quality applicable content. So let me just quickly show you how to create a module. It's very easy. I'm clicking create an assignable module. Bear in mind, this is my account. So I have a lot of organizations and a lot of other existing modules in my account. You may not have that many. Just to start with, I'm going to start with Elsevier licensed content. In the licensed content, there are many courses already available. So you can see there are many courses available over here. Let's say maybe I want to look at this course on medical terminology for blood, lymphatic, and immune system. I select this. So within this course, there are 3 lectures available. I can select all of them, or maybe I just select 2 of them and I add them to my saved items. So you see, I've added the 2 lectures on medical terminology. I already had a few other lectures from the past that I had saved earlier. Now that I have all my saved items over here, I can create a new module. So for my new module, I can use all the 5 items that I had saved. Or maybe I just want to focus on medical terminology and analgesia. So I'll create a module with 3 of the items that I had saved. Now I have to give this a name. I have the option of making it global, which means it would be available to everybody in my organization. I'm not going to do that now. I'm just going to create the module and then I can simply assign the training. So this gives me the option. So let's say this is one of the modules that I created. Sorry. I can just simply assign it and I can even schedule. So the module will generate reminders for all my users. Do I want a reminder to come in 1 day before, 1 week before, 30 days before, like that? So it generates reminders as well. And you can choose individuals, groups or departments who you want to assign the module to. So this way it makes e-learning more engaging, more effective. You don't have to put everything in your online classroom. You can actually schedule some lectures which will be disseminated to students at particular times, and the students will be given the option to attend those lectures when they are convenient in their home or whenever it's convenient for them. So you can actually create these kind of modules from this platform. I'm going to log out now. So just to quickly summarize, how does this platform really help you? It helps you to really not just observe the skill that we are talking about, but also have a checklist, have a view, have an understanding of the other peripheral, unobserved things that people would have not stated, inexplicit things that people would have not stated in a book or in a chapter. It actually lists down all the information that a nurse practitioner needs to absorb before they actually start performing in a clinical setting. So before you actually go to a hospital or before you actually go to a lab, you are already prepared with all the tools, all the arms that you need to be able to perform your skills as you move into the clinical environment. I'm going to pause here and I'm going to open the floor to Q&A. I see there are a lot of questions and some people have raised the hand also. For those of you who've raised your hand, I'm not sure if we'll be able to come back to you, but please feel free to insert your questions in the chat box or the Q&A box. I'm going to ask Jade, can you help me go through the questions, please?
Yes, thank you, Natasha. So let's start with the first question. Does clinical skills integrate with the LMS?
The clinical skills itself does not integrate with the LMS, but at the same time, our goal is not to replace a university's LMS. Our goal is to supplement your LMS. So you can continue using your own LMS, just simply post the links to the skills or the videos into your LMS content. So if you're working on a PowerPoint, just post the links into your PowerPoint slide. If you have an LMS document that you're preparing, you can actually pick up content from the platform, copy paste it into your document. You can copy paste the questions into your document. Only thing with the videos, you will not be able to download the videos. You will just have to paste the links of the videos into your LMS documents. I hope that answers your question.
Okay, thank you, Natasha. So let's go on to the next question. Clinical skills seems to be a global platform. So how can we support the needs of local students?
Sure. So as I mentioned earlier, indeed, it is a global platform that is based on globally collected best practices. And I want to emphasize globally because we are not looking at evidence-based clinical guidelines from a particular country. We are picking up clinical guidelines from all over the world. Having said that, as I mentioned, if you are the administrator or if you are a faculty who has access to the more advanced platform, in the advanced platform, you have the option of editing the skills also. So you can actually make changes to the textual content. You can make changes to the questions so that you are able to localize the content for your own institution. We do agree that while global best practices are global and they are best practices, that's very good. Yet every single university or hospital may have their own best practices that they would like to adopt. They may be better than global best practice, and we respect that. So the administrator does have the option of editing the content to the point that you are able to customize it for your institution. If your institution decides to subscribe to the platform, we will do the training to show you how to do the editing for the content.
Thank you, Natasha. So going on to the next question, what role does clinical skills play in blended learning?
That's a good question, actually. So what does blended learning really mean? Blended learning means that we are not relying on only one type of information or education source. We are not relying on only books or only videos. That's blended learning. With clinical skills, you have the ability to read textual content and combine it with video and images. What Elsevier would like to see in a perfect world, what we are trying to achieve is to combine all our platforms and contribute to blended learning. So you could have clinical skills or you could have clinical skills with another simulation platform that your university is already using. Or you could club clinical skills along with a 3D imaging platform or a anatomy platform that your university is already using, and put together a combined lecture. And we are going to be doing other webinars, other sessions, more customized sessions on how to really create those blended lectures. So in a blended lecture, you would have some information and a video coming from clinical skills. You would have some information coming from an ebook. You would have some information coming from a simulation platform or a telemedicine platform. And that's how you create a comprehensive blended lecture. And we do have some videos on those blended lectures as well. We can share them after the webinar, and we will be conducting more webinars on how to create those kind of blended lectures as well. I hope that answers the question.
Natasha. Okay, Natasha, let's go on to the next question. Does the platform also provide different case scenario on different clinical area that can be used in replacement of actual patient cases?
We don't have case scenarios in video format in the platform yet, but notice there is a lot of text. So the faculty can actually build their own case scenarios. There are a lot of questions available for each skill, and the questions include some case-based questions also. So at the moment, we don't have case scenario videos in the platform, but you can use the text to build your own case scenarios as well.
Thank you, Natasha. So we have a question from a lecturer who is teaching the medical students. So are there any skills encoded on clinical skills platform that can be used for medical students?
At the moment, the platform mainly focuses on nursing learning. We are working on similar platforms for medical skills as well. As you can imagine, the medical skills part is more complicated because there are so many specialty skills. So it's very hard for us to develop a comprehensive platform for that one. At the moment, this platform is best suited for nursing skills. Having said that, we are aware of certain hospitals who are using this platform for skills development for medicine graduates, for residents as well. So they are using the same, because the skills are the same. So they use the same kind of skills content to kind of train their residents as well. They are using that in the hospital setting. But personally, my opinion is that the platform is best suited for nursing education.
Thank you, Natasha. This is a long question. So how do you evaluate students' performance related to clinical skills they learned? And how do you conduct the evaluation by the checklist in the clinical skills? So is it a self-evaluation form conducted by the students, or is it going to be like a, educator-driven or lecture-driven kind of? Yeah.
So let me just show you what that checklist was. There are two parts to that question. At least my response has two parts. Just waiting for it to load.
Meanwhile, just to reiterate, if you wish to request for institutional trial, click on the link on the chat box to go into the feedback form and to request for the 2 months complimentary trial access for institutional license.
Right.
Yeah.
So let's just break down the question that you asked me into two parts. One, how can this checklist be used for evaluation as well as for self-evaluation? So what we have observed is that in the university as well as in the hospital, the faculty or the nurse managers, they take printouts of this checklist. And when the nurses are performing the skills, they use the checklist to check or uncheck whether certain criteria were met or not. So sometimes they inform the nurse that the nurse is being observed, sometimes they don't. But they basically observe the nurse and they check or uncheck whether the skill is being performed or not. The same can be done by the students. If the students want to self-study, if they want to self-learn, they can also print out this checklist. And while they perform the procedure, they can keep checking or unchecking. Hopefully they will check everything. while they are performing the procedure. So that's how this current checklist is being used already for evaluation, both in live as well as in an online setting. So in an online setting, you could ask your student to demonstrate a particular skill, and at the same time, keep the checklist ready with you to, and they can, so in our previous webinar, if you remember, we even showed that there was a particular student, he was working on a project and he tried to demonstrate certain physical examination skills on his brother, and the faculty was observing that. And this was all done virtually via telemedicine. So you can ask your students to perform or demonstrate, virtually demonstrate certain skills while they are in the home, and you can use the checklist to check or uncheck whether the student performed as per the checklist or not. Having said that, I will never say that this checklist is comprehensive. I mean, it's comprehensive for this particular skill, but for examination purposes, a university may have their own criteria, or a examination body may have their own criteria. So I would never say that if you've done everything on this checklist and performed it to the T, you're perfect for your examination. As a faculty, you must still think about what are the local nuances that the student needs to be aware of, what are the local nuances that the student needs to take notice of when they are preparing for a board examination. So while this is a very good tool for practice, it is still not enough. It will, no one single tool will ever be enough for examination preparation. So that's how I would look at it. It's a great tool for learning. It's a great tool for day-to-day learning. But then for your laboratory examinations, for your practical examinations, you may want to merge in skills or best practices from your local learning as well. I hope that answers the question.
Natasha. So I think, let me see. I think that's the end of the Q&A session. Any other questions? Yeah, I've checked all the list of questions. Yeah.
Okay, great. So if there are no further questions, I just want to quickly also share a few additional resources. These are complementary resources that are now available all over the world to our clients as well as other universities. The first resource that I want to introduce to you is the Elsevier COVID-19 Healthcare Hub. As I mentioned at the beginning of the presentation, one of the biggest challenges for healthcare professionals, not just nurses, but even medical professionals, was that they were working at the front lines of COVID and trying to keep up with the changes in clinical guidelines, workplace setting, patient expectations on a daily basis. So to support our frontline workers, people who are dealing with COVID every day, we've created this platform that has all the content, be it skills learning, be it checklists, be it drug information, disease information, everything that you would need to know about COVID-19. It's all available on a single platform. And I would encourage you to browse this. There are a lot of skills as well as care plans and order sets available on the platform related to COVID. So these might be beneficial for you. The other additional resource that I want to share is the Elsevier Health Education Hub. Again, this is not limited to nursing only. This is useful for all types of health education. And it is mainly to support faculty who are trying to create innovative and engaging online lectures. So on this platform, you will have access to a number of pre-built exercise worksheets, videos, lectures, short courses that you can just download from here and use in your online classroom. So for both of these platforms, the link is at the bottom of the slide. You can just click on the link and you will be able to access this platform. As I mentioned earlier, for clinical skills, the new platform that we just introduced, if you would be interested in setting up complimentary access for your organization, please click on the survey link in the chat box and just let us know. We will get in touch with you and we would be very happy to set up a complimentary access for your organization. With that, we come to the end of this presentation. I hope you found this useful and exciting. If there is anything else that we can do for you, please don't hesitate to contact Jade or me. My email is at the bottom of the screen. So please don't hesitate to write to us. And as I mentioned, if you're interested in the complimentary access, just fill out the survey link and we will get in touch with you. Thank you very much for your time.
Yeah, thank you, Natasha, for taking your time to share your perspective and experience on clinical skills. So just a quick summary of the free resources that is available. I will be sharing the link with everyone after the webinar, maybe 1 or 2 days after the webinar. So after the end of the session, there will be a feedback form, survey form. So kindly complete that form, and if you wish to request for a 2 months complimentary access to the institutional license, kindly do so as well via the survey form, and we'll get in touch with you shortly. So with that, I think on that note, thank you for your participation, and we wish that you have a great day ahead. Thank you so much. Thank you, Natasha.
Thanks, Jade. I noticed some people are just asking for the evaluation link, so maybe you can just paste it again in the chat.
Okay.
Thanks, Jade. So for Jade is helping us paste the evaluation link in the chat again. For those of you, she just did that. For those of you who would like to set up complimentary access for your institution, just click on the link that Jade has just pasted and we will get in touch with you.
Yeah. This link will be sent to you as well 1 or 2 days after this webinar. If you have no other questions, if you have any questions, then yeah, that will be the end of the session. And thank you everyone for attending the session today. You received the thank you email from us maybe about 2 days after today, after the webinar. Yeah.
Jade, a few people are asking if they have certificates for attendance. So you will be receiving a thank you email in a couple of days after this. In the thank you email, you will have the option of printing out your certificate of attendance as well.